Time now is 8:13. Reps for Aerosmith frontman Steven Tyler recently announced the cancellation of Aerosmith's planned Las Vegas residency for June and July because the lead singer had voluntarily entered rehab. The 74-year-old singer went through foot surgery as the band was prepping for these intense shows, but the pain medications caused him to relapse. Steven Tyler over the years has openly discussed being in previous rehab programs and using drugs and alcohol in the early years of the band. In 1988, he went to rehab, most recently 2009, for prescription medication abuse. So here to talk about this and some of the risks that are involved in relapse when somebody has been trying to stay clean for so many years is Dr. Vivek Iyer, the Director of Pain Management at Cancer Treatment Centers of America. So thanks so much for joining us. And I thought of you right away when I saw this article because that is a real challenge for someone who has been through this battle for decades. And you know you're going to go under and you're going to go through a painful surgery. How do you recover from the pain without risking this scenario?
So I think one of the biggest misunderstandings about surgery is that opioids help all types of pain. And actually the most common types of pain after surgery are muscle pain and nerve pain. So muscle pain will feel like spasms, tightness. Nerve pain will feel like burning, sharp, shooting pains. And opioids, ironically, are not the ideal types of medicine for those types of pains.
Oh, really?
So many times you may take a pain pill, an opioid, and feel like it doesn't quite help enough, and maybe because it's one of these other types of pains. We're all human beings. Our instinct might be, maybe I'm not taking enough. Maybe I should take one more. Maybe I should take it a little more often. And in reality, they're not really taking the perfect medicine for the types of pain that they're having.
Interesting. Okay, so it's the type of medication for the type of pain, plus these are conversations that probably need to happen when somebody is going in. Obviously, we don't know if somebody's going in for emergency surgery, whether they have a history of addiction or not. But if you're going in for an elective surgery, these are conversations that have to happen prior to.
Absolutely. I think communicating with your surgeon before surgery, what are my options? Is there anything besides an opioid that you might be giving me to help with my pain to address some of these other types of pain? Are there nerve blocks that could be done? Potentially the anesthesiologist might offer a nerve block that can give some pain relief for a day or so after surgery. So having that conversation ahead of time so that even nowadays with this concern of opioid addiction, patients are asking, what else can you give me besides opioids? So the conversations are happening. I think the surgeons should be more prepared to handle these types of conversations.
And when you're treating pain with patients afterwards and the follow-up, and you know that you don't want the go-to to be just more pain medications, what else can you do?
So there are medications that you can give almost we use the term multimodal, but kind of a cocktail of medicines where there's something to address nerve pain, something to address muscle pain, something to address inflammation. And then it is always okay to have an opioid, but you don't want to have it as the main medication that you're relying on, but more of the backup if everything else isn't quite working well enough.
So is your job in treating pain but keeping people well at the same time getting easier right now as people are becoming more aware of some of the risks and how addictive these things are? We just came off of watching Dope Sick, the series over the weekend, and I mean it's just staggering how even the brain chemistry and everything changes in the body so that you feel you have so much pain without this, whether you do or not.
Absolutely. I would say 5 years ago, before this concept of opioid epidemic came about, there was this instinct of, I'll just take the pills when we would offer things like nerve blocks and other types of medicines. But the reality is now patients are more educated or more interested in wanting alternatives. And so I think they are coming more prepared to surgeons. How can you help me? And that's our job in the medical field to rise to the occasion and meet those concerns and offer the type of services that they need.
Okay. And we hope to have you back to talk about another situation, that terrible Tulsa shooting, pain management and the pain after surgery, one of the motivators of that horrific act of violence at the hospital. So, Dr. Iyer, thank you so much for your insight today.
No
Appreciate
problem.
it. Good to see you.
Thanks so much.
Scott?